Hello, and welcome to Leadership PRN. This is the Faculty of Medicine's podcast for leaders, both new and established. My name's Dr. Lara Hazelton. I'm a psychiatrist and Director of Faculty Development here at the Faculty of Medicine. Today, I'm very pleased to have with us Dr. Brent Young. Hi, Brent.
Hi there. Thanks for having me.
Brent, can you tell us a bit about yourself and your role with the Faculty of Medicine?
So I'm the Academic Director for Indigenous Health in the Faculty of Medicine. I'm also a family physician, and I hold a role in the Department of Family Medicine through Wajaywanan Health Centre, which is based out of the Mi'kmaq Native Friendship Centre here in Halifax. And I have a practice in Sebaganagati where I practice family medicine as well.
You want to tell us a little bit about what's involved with some of those roles?
Yeah, so in terms of the Academic Director of Indigenous Health role in the Faculty of Medicine, it's a role that I've had since July of 2021. And it's really a broad role, I will say. And having been the first person to come into this role, it's been a lot of, I think, trying to determine kind of the scope of that role and figuring out where the priorities lie within the Faculty of Medicine for the Indigenous health portfolio. And so really what I see the role as today is largely a strategic role within the Faculty of Medicine, where I'm able to be that bridge between the Indigenous community in the region and, of course, nationally, and the Faculty of Medicine. And so to move some of the shared priorities forward for both community and the Faculty of Medicine when it comes to Indigenous health.
And so you say it's strategic, and you're working with the Faculty of Medicine in that role. Actually, we just had Dr. David Anderson interviewed, and he was talking about the Faculty of Medicine's commitment to Indigenous health and other social accountability areas. How do you see that strategic alignment working with the Faculty of Medicine and how you contribute to it?
I think there are a number of overlaps. So the strategic plan that we have within the Faculty of Medicine, and one pillar of that plan, and I think we're now changing the terminology around that. I think STREAM is the new terminology that's being used, is around serving and engaging society. And of course that is being led by Dr. Gaynor Watson-Creed within the Faculty of Medicine. And so we fall underneath that bucket of work within the Faculty of Medicine. But more broadly speaking, I think the Faculty of Medicine has a social accountability mandate to actually rise to the calls of the Truth and Reconciliation Commission of Canada, and they were published in 2015. And so we're now, I think, about 8 years out from the publication of those calls to action. And so this is part of that work as well. And so we have a number of stakeholders at the national level in terms of folks who are leading the Indigenous health portfolio with various leadership organizations who are kind of trying to hold faculties of medicine to account in meeting those calls. And so I'm able to again be a bridge between the Faculty of Medicine and some of those organizations as well.
We actually had Dr. Watson-Creed on the podcast a few months ago, and she spoke as well.
Yes, yeah. I'm sure she had many excellent things to say.
What brought you to this type of work?
I think, as an Indigenous person, I'm Anishinaabe. I was born and raised in Cape Breton, but my grandmother was a residential school survivor. She went to Sandy Bay Indian Residential School, and then unfortunately had all of her children taken away during a period known as the 60 Scoop, and my mom was adopted out to a foster family. She spent the first 3 years of her life in foster care, where she actually didn't speak any language, let alone her own language, which would be Anishinaabe-Moan, and then was adopted out to a white family who happened to be a military family that traveled across the country. And so we landed here in Mi'kmaq, in Cape Breton specifically, where I was born. And so it's been a journey, I think, of reconnecting a lot for both me and my mom and the rest of my family, and trying to figure out kind of what our place is within the Indigenous community here in Mi'kmaq, but also kind of more broadly in the efforts that are going on across the country. And so it's always been an area of passion to me, and having attended Dalhousie as a student, both in my undergraduate studies and my master's and medical school, became really involved in some of the advocacy work that was going on in this sphere. And of course, within the Faculty of Medicine, as a medical student, had led a push to found or be a co-founder of the Student Diversity and Inclusion Committee with actually Dr. Leah Jones, who is our new academic director for Black Health. And really recognizing the strength that we can bring to the table when we bring our voices together, and identify shared priorities and goals for advocacy. And so that's kind of where it started here in the Faculty of Medicine. And then I went off to the University of Calgary for my family medicine residency, and had actually been interested in coming back to Nova Scotia and trying to figure out like what my role would be, both within the Faculty of Medicine, but also in my clinical practice, what the opportunities were for me to serve my own community.
And it's going well?
Yeah, I think it's been a bit of a whirlwind. I wear a few hats, and as I had mentioned earlier, I think each of those hats brings something different to the table, and it's been very interesting to see how they can complement one another. And it's been, I think, having been involved with the foundation of the clinic at the Mi'kmaq Native Friendship Center through Wajaywanin Health Center, having worked to bring that up off the ground with the Mi'kmaq Native Friendship Center has been very interesting, an interesting process, and learning kind of who the decision makers are within the healthcare system that can help us advance some of these priorities that we have within community. So that's been kind of an interesting part of the work. But then how that ties into kind of my role in the Faculty of Medicine, whether that be through policy development or implementation, or through things like curriculum development and helping learners kind of understand some of the complexities and the issues that we're facing as Indigenous people within the healthcare system.
It sounds like there's a lot of different aspects to the work that you're doing. What excites you about your work?
I think the most exciting thing for me, first and foremost, is again going back to being able to serve a specific need or a specific niche for my own community, and knowing that there are not many Indigenous physicians in the region or even across the country that have made it, I guess, this far into their training, and to be able to be an advocate, to be the voice of community within the medical profession is very exciting for me, and also goes back to my own kind of personal desire to be able to reconnect with community and whatnot, and be recognized by community as somebody who has something to contribute. Has been very fulfilling for me. The other thing that excites me, I think, is that oftentimes we can get bogged down in a lot of the negative things that are happening within the healthcare system, specifically around Indigenous people, but also even outside of what's going on with Indigenous folks. We're experiencing a lot of challenges within the healthcare system in Canada. But I think there are real kind of opportunities for growth and innovation within the realm of Indigenous health. And as I mentioned, we were seeing some of that with the clinic, like with Wajaywanin Health Center, for instance, where we're able to actually have a little bit of flexibility to provide care that maybe wouldn't otherwise be provided within the healthcare system. So, for instance, using kind of trauma-informed and culturally specific kind of approaches to addressing issues, we're able to implement things like offering people like IV antibiotics within their family medicine clinic, and being able to keep people out of the emergency department with very simple interventions like that, and having the space and openness among kind of the healthcare system to be able to pursue some of that has been a huge opportunity, I think. And of course, some of the kind of exciting things that are happening within the Faculty of Medicine would be around like the curriculum refresh. And so I came into the Faculty of Medicine at a very opportune moment, I think, with the curriculum refresh, where we're looking at diversifying a lot of the cases that are in our case-based curriculum. And so now we'll see the introduction of about 22 cases that involve either Indigenous patients or Indigenous health content, which, if you had asked me probably 5 years ago or when I was a medical student, I think there was an impression that there was not much space for that. But we've seen a shift now that there is space and there is openness to pursuing some of that. And I think that's really only the beginning. It's probably not enough, I don't think. But over time, we can use that as a foundation and continue to build within our curriculum and produce physicians who are well versed and who become experts, I think, in the area of Indigenous health, especially where we're hoping to bring more Indigenous folks into the profession.
What do you think leaders should know about Indigenous health?
Yeah, that's a very good question. I think a lot of leaders struggle with Indigenous health, and some of that comes from the fact that many leaders perhaps don't even really have many connections with the Indigenous community. And in fact, some leaders maybe don't even really know Indigenous people in their personal lives or even in their professional lives, maybe haven't interacted with Indigenous people. So I think the main thing that leaders need to understand is that relationships are very important. And even more so in this context where relationships have been strained and there is a lot of mistrust. So getting to know those people who are stakeholders and rights holders within the health system is an extremely useful way that we might be able to move forward in navigating some of this complexity. And so I'm very open to people kind of approaching me and kind of asking me what they should do and with certain issues and whatnot. And I'm happy to help navigate some of those questions. And unfortunately, I think there's an expectation that like I might have the answer to some of these questions, and in fact I don't have the answer to a lot of those questions. But even giving people that reassurance that like this is by nature a very complex issue. Indigenous health equity or inequities are very complex and fueled by hundreds and hundreds of years of systemic racism and colonialism, and we all have a role to play in navigating that in a way that's kind and gentle, and that means being kind to ourselves too, and with one another. Not that I think people are somewhat afraid, like it's an unknown to them, like they're afraid that they're going to make a mistake. And I've had so many people approach me with these questions around like, how do I do a respectful land acknowledgement and like all of this kind of stuff. And I think we get caught up in those very small details when we're really worried about managing perceptions and whatnot. People are worried that they're going to make a mistake around a land acknowledgement, when Indigenous people actually, like, we're not really looking at land acknowledgements and putting them under a microscope. It's really a small piece of the work that needs to be done. And I hope we can get to a point where we're able to sit down like we are even in this podcast today and just have a conversation and get to know each other a little bit better as Indigenous people and as settlers within Canada.
It's interesting. Actually, I think you were out of the clinic I work with as a medical student, where I work at Cobequid. I think I was one of your supervisors for a rotation a number of years ago. And thinking about that, like about relationships, as you say, what would be some, like you mentioned reaching out to you, but what would be some ways that people could, other than reaching out to you, establish relationships? Are there any you can think of? Or?
I think it's very context dependent, and so it's hard to make a broad recommendation as to this is somebody that you should be reaching out to, because I do want to acknowledge as well that there are a number of, I think, highly visible leaders within the Indigenous healthcare system that get approached quite often by a number of organizations, individuals, with questions that people have. And so it can be very overwhelming, and people are often like feel that they're not being heard or that they're being maybe ignored. But it's actually, I think, more of a function of people being inundated with a lot of these requests. And so it's hard to say, like, just go to this person or that person. But I think getting to know community in the sense that, like, there are powwows, like there's the Maui Omi that happens here at Dalhousie on the campus every year, and the Friendship Center hosts a powwow every year that we would be happy to see faculty members come to. We'd be happy to see staff come to, and I think there are small opportunities like that exist to start building some of those relationships and awareness and visibility within community. And again, people are scared to even do that. People are scared to go to things like powwows and cultural events, when in fact, actually, those are some of like the most beautiful events and happiest events. Like, we're happy to share culture and food and space with people, and you don't have to be Indigenous to attend things like that.
That's good to know, because I think a lot of people probably would wonder if they should attend something like that. So that's good to know.
Yeah, and it really, like, those events are a celebration of our cultures and traditions and whatnot, and we're more than happy to share in that.
Are there next steps besides maybe reaching out to communities that you would encourage our listeners to take?
I think it requires some work, both individually as a human being, to reflect on what is my role in this big picture of colonialism that has occurred and continues to occur in Canada. It requires a critical eye to that, and we all hold biases towards other people, and we all hold biases that we've internalized as Indigenous people about ourselves. And recognizing that, I think, is a very important first step for folks, because it really helps to unpack some of the more complex issues that we need to deal with. So if you have an understanding of your role as a non-Indigenous settler in Canada, and the benefits that you've received as a non-Indigenous settler within Canada, whether that be being able to purchase a piece of land, whether that be somebody who is benefiting from the social safety net in this country that is largely funded off of the backs of Indigenous nations, off of land that's been stolen from Indigenous peoples. Understanding that is a much different position, puts you in a much different position when community comes and asks for funding for things like primary care, for mental health systems. And so I think really doing some of that deeper work shouldn't be discounted. Like, I think some people think of that as like, that's fluffy. That's like, I need to get a task done. I'm task oriented. I'm a leader. But being a leader is also about kind of understanding your own positionality within this kind of colonial project that we call Canada today.
And are there any books people should read, or good website to visit, or?
Yeah, I think like there are a number of books that are published in this area. A starting point for folks, I think, and really is something that changed my perspective on this issue, is a book called The Inconvenient Indian. And so I often recommend that to folks. And if folks have heard me do any sort of professional development, I've been talking about that book for a while. So if you've been waiting to pick up that book, I would suggest maybe now would be the time if you haven't quite yet. And it really it frames kind of the historical context of colonialism in Canada in a way that I haven't seen it framed elsewhere. And it gives us that context that we need to understand that this is not only a handout, because I think there's this misconception that Indigenous people are looking for handouts, and that's not what we're looking for. We're looking for access to resources that rightly have been ours since the beginning of time in North America. And so I think maybe starting to read some of that. And then there are more specific, like, healthcare type documents. And so there's the Indigenous Health Primer that was published by the Royal College not too long ago. And there will be a number of kind of guiding documents that come out of the National Consortium for Indigenous Medical Education that I think over the coming months to years will provide guidance for the medical profession as well.
Is there anything else you'd like to add to the people who are listening to this podcast?
I think the biggest thing, and maybe what we haven't really touched on today, is that the Faculty of Medicine is changing, and I think it's changing at a rate that we haven't seen in the past. We have the Indigenous admissions pathway that had just completed its first cycle, and we'll see a number of students coming through the Indigenous admissions pathway in August of 2023. And with that, we will have Indigenous students who have real kind of lived experiences and connections with communities, especially Mi'kmaq students. We have a larger number of Mi'kmaq students coming in through this pathway than we've ever seen in the past. And those students really are going to need a lot of support and guidance, not only from our programs that are Indigenous specific, but also within the Faculty of Medicine and our distributed sites. And so I want to stress some of the most common things that these students will face is doubt within themselves, because they've been told their entire lives that they maybe weren't good enough to get into the medical school, but also doubt that people push upon us that, oh, you only got in because you're Indigenous, when in fact these students are very strong students. When we look at their average academic scores, whether that be the GPA or MCAT, on average these students actually far outperform the minimum scores that we require of all students coming into the medical school. And so there's this misconception that this pathway is not as rigorous, that these students are not going to perform in the same way as others. And I really want faculty to know that is not the case. And in fact, that can become a self-fulfilling prophecy if we don't address that upfront. And if we don't welcome these students and support these students with open arms within the Faculty of Medicine. So I'd be happy to leave it with that. And if folks do have questions about kind of the pathway and how students are doing within that pathway, I'd be more than happy to chat with the faculty about that as well.
Thanks so much for speaking with us today, Brent. I really appreciate you taking time out of your busy schedule to do this.
Yes, thanks for having me. This is great.
And that's another episode of Leadership PRN. If you have a topic you would like to hear covered or a guest you would like me to interview, feel free to reach out to me at lara.hazelton@dal.ca or lara.hazelton@nshealth.ca. Until next time, take care.